Hi, this is James Frey with Alberta Health Services for Health Matters. Today we're talking to Dr. Barbara Lacey. She's the chair of the Oldman River Health Advisory Council. Now, Dr. Lacey, can you explain what the Health Advisory Council does?
Well, the Health Advisory Council is really a communication conduit between the communities and the government, the Alberta Health Services. So there are 12 of us around the province, 12 zones around the province, and each one of us have a group of citizens who volunteer their time and give input to the Alberta Health Services and receive back stuff that Alberta Health Services wants help with or wants disseminating and things like that.
Okay. So, and within South Zone, there are two health advisory councils, correct?
Yes, there are. There's one in the Lethbridge area and one in the Medicine Hat area. And we're both about 15 people of differing ages and differing backgrounds, and we represent the communities across the south.
And how often does the Health Advisory Council meet?
We meet approximately every 2 months. And we may have special meetings in between, or we may go out and make a visit somewhere or this sort of thing. But basically, it's every 2 months.
Mm-hmm. And Health Advisory Council members try to get involved in different events and things that Alberta Health Services runs, right?
Yes, we try and get involved in and to promote the health services and promote Alberta Health Services. But we also want to get involved because it's a way that we get input from the communities with the different organizations that we're all involved in, because really one of the main things we try and do is raise issues that come up in the health services in our area. Mm-hmm. So if there is a concern that, particularly if it represents more than one person, if it's a general problem, then we make recommendations to Alberta Health Services on that issue.
Mm-hmm. Now, when you meet, there's an opportunity for public to have input during the meetings?
There is. We always have a public session, which is usually about 5:30 in the evenings. And I would ask people to look for the adverts because we move our meetings around the area. Several of them are held in Lethbridge. But they may be different locations within Lethbridge. And then we go out. We're going to Tabor next in May. And we've been down to the Crowsnest Pass and Fort McLeod and Warner and down in that area. So we try and get round the region as well. And we try to advertise where we'll be. And there is a session where the public can come in and make presentations to us. Mm-hmm.
And oftentimes those meetings are publicized on the Alberta Health Services website as well.
They are, and through any local press, or if the representative from that area can put up notices, and however we can get the information out, we try and use that.
Mm-hmm. What sort of issues do you generally hear at the meetings from the public?
It's usually about the services that are provided. There's not enough, or there's difficulty in accessibility, or there's an issue within, during a course of treatment or something like that. For example, we've got involved a lot in the physician recruitment in Warner, mm-hmm. In Milk River actually, and we've had lots of meetings with the community down there, and they have a committee that's working on it. And so we've talked to them, and we've talked to the physicians, and we've talked to the zone, and we've sent recommendations up to Edmonton. And we're also getting involved in physician recruitment in many of the other smaller communities, because it is an issue. Mm-hmm. And not only just recruiting them, but retaining them, keeping them there. Mm-hmm. So we want to make the community aware of what's going on and make sure that they do everything they can to help these physicians who are usually not coming home. They're coming to a strange community, mm-hmm. and make them feel welcome and part of the community.
Mm-hmm. Okay, great. Well, thank you very much, Dr. Lacey. This has been some good information. This is James Frey with Alberta Health Services for Health Matters. See you next time.